Welcome to our SmileFy implementation course. This course was designed for you as a step-by-step guide to learn how SmileFy can help you enhance your communication with your patients through AI smile simulations. How to organize your patient files in one place and to create, edit, and export multiple facially driven smile design quickly for your patients. The SmileFy software is designed for you to deliver higher predictability in your dental cases. So let's get started. In today's agenda, I'm going to talk about the course overview, the devices you need and how to get connected, as well as the smile simulation step-by-step process. So let's start with the course overview. We are going to have 3 weeks available for you to learn the SmileFy software. During the first week, you will be learning how to take the proper frontal picture for your patient, how to design smile simulations using the facial analysis, how to present the smile simulation to your patients during the first appointment, and learn the steps to transition from a smile simulation to a mock-up design. During the second week, I will teach you step by step how to use the automated 3D design workflow. I will show you how to create your first mock-up design and how to export your files ready to print. You will also be learning how to collaborate with your lab using SmileFy Team Up functionality and how to export all the patient files that are needed. On the last week, it's all about the team training. We invite your team members to join this training. This week is designed specifically for your team to understand how to take the proper photos for SmileFy and learn and practice presenting the smile simulations to your patients. So, if you have somebody in your team that is willing to learn the step-by-step process on how to upload the patient files, create a smile simulation, and export the patient's data, including the 3D design, then this training is for you. All right, let's start with the devices. In terms of device, you will need an iPhone, an iPad, or a Mac device. And very important, make sure that the iOS version is up to date. To check the iOS version, you'll need to go to Settings on your preferred device, then go to General and Software Update. Now, on the iPad and iPhone, the latest iOS should be 18.3. You'll have to check the latest update. And on the Mac, the latest Mac OS is 15.2 Sequoia. Now, because this course is going to be recorded, at some point we'll have a different iOS version here. So please check your iOS version and make sure it's updated to the latest version. Now let's talk about patients' intraoral scans for 3D design. In terms of files needed for intraoral scan, you can use STL format, PLY, or OBJ. For picture protocol, you will need a PNG format or a JPEG format. Now let's talk about uploading your files into SmileFy. We have different cloud options and you can use SmileFy Drive as an option, or you can also use Dropbox and Google Drive. Let's talk about the digital workflow. This is what we will be learning today: how to create the patient digitalization into the SmileFy software, how to add or import the intraoral scan with the picture, and export the proper files that we need. Next week, we are going to talk about the 3D smile design workflow and how to 3D print your designs. Let's start with the smile simulation. When doing the smile simulation, you will need one picture, which is the frontal picture of your patient. You can do the smile simulation at the first appointment to understand your patient desires and educate your patient for the best treatment outcome. In the end, you can share the image with your patient before and after picture side by side and communicate better with the patient. Let's talk about the requirements that we need for our picture. When taking the picture of your patient, there are a couple of requirements that are important to make sure that you deliver a natural looking smile. Let's start with the room setup. You will need a dimmable ring light and make sure that the distance when taking the picture is about 3 feet away. We want to use the ring light mainly to ensure that you have a uniform light on the patient's face, and a solid colored background is preferred. You can use the wall, white, or a backdrop that can be colored to ensure that the picture is looking professional. Other things to keep in mind: make sure that the patient is standing up and that the head is centered. Patient should have a natural head position. Eyes should be leveled with the lens of the camera, very similar to what you see here. Hold your iPhone or iPad straight. For the mouth area, we need to make sure that we have a big, wide smile. Ideally, the upper and lower jaw should be slightly apart so you can have the incisal edges of the anteriors and posterior teeth visible. And make sure that you can see both ears visible. This will ensure that you have equal visibility on both sides of the face. When performing a smile simulation during the first appointment, we created a step-by-step process for you to use and integrate in your daily workflow. Let's start with the first step. The first step would be to bring the patient to the consultation room and ask your dental related question. In the second step, we have the patient in the clinical room where the dentist will perform a clinical evaluation and checks on any complementary exams. After the second step, you can take a frontal picture of your patient and perform a smile simulation for your patient. You can ask the patient to wait a couple of moments, usually about 5 minutes, to design the smile simulation. And in the fifth step, the dentist will present the treatment options, and shows the before and after picture either on the iPad or on the monitor. It's important to understand that the smile simulation cannot be shown on an iPhone since the screen is very small. Therefore, we encourage you to use either the iPad or bigger monitor. So, let's talk about the vision, which is listen to your patient, identify their wishes and fears. To present a smile simulation that will help you understand the final outcome for your patient. Let's do a smile simulation step by step. Open the SmileFy app on your preferred device. You can use your iPhone, iPad, or Mac. And on the top left corner of your screen, you should have the menu bar. Select that. And here we're going to start with a new patient. We have two options available for you. The first one is called 2D Smile Design, and this one is mostly used for cosmetic cases. The second option, 3D Smile Simulation, is used for a dentulous or partial dentulous cases. So here you can actually design an upper and lower denture design for your patient, while in the 2D Smile Simulation you can do only the upper jaw. So let's start with the 2D first. And here you'll have the full smile. I'm going to select the plus. Now you have different cloud options where you can upload your picture. The first one is called SmileFy Drive, and I'm going to show you now how to upload the picture in your SmileFy Drive if you took this picture with a different device. So if you didn't use your iPhone or iPad, maybe you use a DSLR or you have this picture saved on another device, you can use SmileFy Drive to upload not only the picture but also the intraoral scan. For the SmileFy Drive, you will need an internet browser. It can be Google or Safari. It's not necessary to use or access the SmileFy Drive from the same device that you are using the SmileFy app, so it can be actually used on your Windows computer. All you need is to open an internet browser, and we are going to type drive.smilefy.app, and once you access this link, you'll have this page where you can add your SmileFy account, the same SmileFy credentials that you are using to log in into the SmileFy app. I'm going to use my account. And once you access it, you'll have 10 GB of storage, and you can start uploading the picture. To be organized, you can create the folder first. So here I'm going to add the patient's name. And then once the patient is created, I will double click on the folder, and now you can upload a file. Here I'm going to start uploading patient file. Let's start with our patient for today. And once the picture is uploaded, all we have to do is to get back to our SmileFy app software. It can be on another device. So here I'm using the Mac. And once I click on SmileFy Drive, I should have the connection. So here's the patient that I just uploaded and the JPEG picture format. Now, there are a couple of other options for you to choose if you are not using SmileFy Drive. The quickest way would be to take the picture within the SmileFy app or to upload it from your photo gallery. It means if you took the picture with your iPad, you should have it uploaded in the photo gallery. So you can absolutely take the picture from there. The other option would be to take the picture. If you have your iPhone or your iPad, you should have that option available. And that means you can immediately take the picture and that picture will be uploaded here. The other options are Google Drive, Dropbox, and iCloud. All right, let's start with our AI smile simulation. Select AI smile simulation on the bottom. And the first step, before we even set the 2D smile frame here, to have a facial flow analysis. And this will help you analyze the patient's facial characteristics before you start designing the case. A couple of things here. The app will automatically set these points for you, and it will give you the facial midline, which is indicated by the red line, and the dental midline, which is indicated by the white line. In both cases, you should have an idea of your dental midline or your facial midline. These points can be also adjusted manually if needed. And the app will tell you the dominant side of the patient, which is the red side, and the less dominant side, which is the patient's green side, which is the left side. Now, once you remove the facial flow, you can adjust the position of the midline and the length. So let's start with the dental midline here. You can select the two arrows and drag the small frame towards the dental midline. And for the length, I'm going to use the other two arrows here to help me understand the ideal length for the two central incisors. So we always start with the ideal length of the two central incisors. That means sometimes we want to keep the existing length. Sometimes we need to reduce, and other times we need to improve the length. So for this specific case, we actually need to improve the length. Apart from the length, I also have the option to increase the height and the width. If you want, you can keep the symmetry on both sides of the face. So what I usually do is I keep the symmetry here and I select the width ratio on both sides from canine to canine. For the buccal corridor, we are going to use the buccal corridor slider. And the last one would be the smile curve, which can be adjusted on both sides or individually if you remove the symmetry. So if you remove the symmetry and you have an asymmetrical lip, you can actually adjust the smile curve individually. Once you're done setting the smile frame, we are going to set AI smile simulation. And here the app always gives you these four options. The first two options are with round shapes, open and closed embrasures. And then the last two shapes that we have available, triangular shapes and the mid shapes. You can select one of these templates. Let's start with the first one, round shapes, open embrasures. And with the pinch mode, you can zoom in the picture so you can have it closer. And here, right below the picture, you have the slider, which allows you to preview the smile frame that we set at the beginning, the shapes, and the colors. Now, let's keep our smile simulation on shapes. And the first thing I want you to pay attention is the marking lip area. So here under AI, the first option, you do have the option to use the slider to lower the lip line or the upper lip. If needed, you can select on marked lip and adjust the corners manually. So here I'm going to select the corners and mark this a little bit better. And once you click on mark lip, you should have your design in the patient's mouth. Let's now select Smile Harmony. And in Smile Harmony, you have a couple of options here. Let's scroll all the way down until you find templates. And here you have two arrows, two options for you to select different other templates for your patient. It is important to understand that the shape that you are selecting here influences only the shape of the tooth, but also the gingival margin. And so you will need to select a template that is close to the existing gingival margin and the existing shape of the patient. So here I'm going to start with a template that I think works best. You can also select colors instead of shapes if you want to preview it and have a look on what's gonna look like. And if you like a certain template, let's use J01 here as a reference. You can also select the centrals. You can choose a different variation for the two centrals. So it needs to be selected, one of them, doesn't matter which one, and then you can swipe up. If you select and swipe, it will change the template for the two centrals and the rest will stay the same. So select this template. Now here, if you scroll up, you can also adjust the length of the two laterals. If needed, you can create a monotonic smile which will have the same length with the centrals, and you can also adjust the occlusal plane here, make small adjustments if needed basically for the patient. The midline can be also changed here. I wouldn't change it if you already set that from the beginning. There is no need to adjust the midline here. And then the curve of SPI as well can be adjusted slightly. The rotation for the posteriors, depending on the canines that you selected, you can adjust the rotation for the posteriors as well, like so. And now let's go to frame. And in frame, we have the number of units. So scroll all the way down and you'll find the same options that we had at the beginning, which is basically the 2D smile frame, the ratio here, right? The height width ratio, the number of units. So you can actually start with 4 or 6 units for the patient. So today, to make it simple for you, we'll start with only 6 units. And once you're satisfied with the number of units here, we'll go to colors. And in colors, you can select, we have different color selections here. So select the arrow here and choose a color. I find that number 2 and number 3 looks best for most of the patients. And once you select the color, you can actually customize the color even more. So you can actually either decrease the brightness, maybe it's too much, or increase the warmth so we can make it a little bit more natural. And all of these adjustments are for you to match the existing patient's teeth if needed, or to improve their color by increasing the warmth if you are trying to create a more natural smile, or decreasing the warmth if you're trying to create a more Hollywood smile. Now the blur, it's only for the smile simulation, not for the existing teeth of the patient, or not for the picture. In case you have the posterior teeth that are blurred, they are not looking very sharp, you can increase the blur. And so the focus is no longer on the smile simulation. All right, Last one, if you need to, you can decrease the opacity of the gums. So here as a default, the app always gives you the artificial gums. If you have a gum defect, you will have the option to use the artificial gum here. If there is no need for that, then you can absolutely you can reduce the opacity gums. Last one, it's called upper lip shadow. If needed, you can have some shadow here for the upper lip. You can see that it's here, it's getting a little bit darker. And for the position shadow, in case you're trying to, let's say, you can see the existing teeth of the patient beneath your simulation, you can actually position this shadow a little bit lower so you can cover some teeth or some incisal edges. There is a last step here that is not mandatory. It's called advanced. And if you're using your iPad, you'll find the advanced option in frame. So if you select frame, you should have it about here. And what you can do is you can actually select every single tooth one by one, and you can adjust the height and width ratio for every single tooth. You can manually position these teeth if needed. And you can also link them using this option, left and right, so that you can reduce maybe the width ratio or just reposition them better. Okay, so these options are for you in case you need to customize your simulation a little bit more. Make sure you don't go into the technical details at the first appointment, because we are working on a smile simulation. This is not the 3D design yet. And so it is important, yes, to design a great smile simulation for the patient. It will probably take you 10 minutes at the beginning, but then once you get familiar with the software, this workflow is repetitive. It means that you will be doing the same step-by-step process for each patient. And so in the end, it should take you about 5 minutes to design the smile. Now, we can go next and preview the before and after picture our simulation. And here you have the option to use the slider if you want. You can also use the slider for the side-by-side picture so that you can present it to your patient. Now here we have a disclaimer and we have the SmileFy logo. If you want to customize your patient's picture with your clinic logo and add this small disclaimer, all you have to do is to select the menu on the top left corner, go to account, and here you'll have a clinic logo option. And all you have to do is to upload the clinic logo picture. And here where it says disclaimer, I'm going to show you that you should have the clinic name and disclaimer that I added here, which says for smile simulation purpose only. Now let's get back to our case. Select the menu and select open case here, because we have a case open, continue and save. And then once you go next with the arrow on the bottom right corner, you can add the patient's name. Only the name is mandatory here. And then click on Save Case. Now wait until the patient files are saved in the cloud. Your patient files are not stored on your device, so you'll need an internet connection so that you can save these files to the cloud. And here we have a case management option. Let's get back to our case management. Now, if you want to continue the workflow in the SmileFy app and add the intraoral scan, all we have to do is under the timeline, select and open basically the patient files. And once you open the patient files, you can see that we already have the picture. Scroll down and under intraoral scan and 3D objects, you can now upload the intraoral scan. Now let's select on the plus, and here you still have SmileFy Drive as a cloud option for you to upload the files. The other options that are available are iCloud, Dropbox, and Google Drive. And if you have Medit, 3Shape, or Align Star, we actually have the direct connection with one of these options. And so as of right now, if you have 3Shape, for example, you can select the 3Shape option here and use your 3Shape account. Once you log in, you should have access to all your patient's data. Now I'm going to use SmileFy Drive again here, upper first. Then the lower. And then we're going to select Now that we have the intraoral scan added, we can calibrate these two files together and save the case so that we can prepare second week, which is going to be all about 3D design. Now in this step, we just need to set 3 points here. I'm going to start with the first one. You can select number 1 on the picture. You can bring it closer if needed, and pretty much choose close to the incisal edge one of the teeth. Normally it's always the canine for number 1, one of the centrals for number 2, and number 3 is going to be the other canine. If you have these 3 points set close to the incisal part of the tooth, I'm now going to set the same points on the intraoral scan. And notice that I don't have the points here yet, but if I start with the number 1 from the left side and I select this area, I should have number 1 popping up. I'm going to show you now second point. It's about here, and the last one about here. So once you set the 3 points, you should have this calibrate option. If you don't see it, maybe on your iPad, you need to scroll down until you find it. Select calibrate, and now you should have both files merged together. If you scroll down here, you'll find a slider that will help you visualize the calibration. It should be 90% done here, and we still have to make a couple of adjustments. So here on the top we have position, and you can bring the intraoral scan a little bit more to the patient's right side, and with the rotation we're going to bring it back towards the midline. And last but not least, I can still see the incisal edges of the posterior teeth, and I'm going to bring it down and rotate up with the rotation arrows. So you will be using position whenever you want to reposition the intraoral scan, and the rotation arrows are for you to rotate sideways, up and down. And if needed, you can also balance with the blue arrows here. You can balance one side or the other. And once you're done, you can select up here digital patient, and we should have both models oriented in occlusion. Then we go next. We already have the patient's name, so let's just save the case. And back to our case management. Because we added the intraoral scan, now you can see that I have a digital patient. I have the files calibration, which means I can always recalibrate the files here if needed. and I do have an export option available after I design my mockup. Now, this is it for the 2D smile simulation. That's all you need to know. Next week, we'll be reviewing again how to upload these files, how to calibrate the files, and how to use the automated 3D design workflow.